We have Eleanor back with us again, and she's the clinical fitness coach at the Sports and Cardiology Center. She's going through with us this time round a little bit on the upper arm exercises. In due of time, we're just going to let her take over right now. Thank you very much.
Thank you, Dr. C. All right, so Li Fang, you can move on to the next slide. Okay, so to reiterate what Dr. C mentioned just now about the concerns pertaining to upper body exercise, I'd like to reassure you that any form of exercise is better than none, especially when you are recovering from cancer. Now, this is because aerobic and resistance training, when you are doing it in a structured manner, will facilitate your recovery, especially when you start doing that even during your cancer treatment. It strengthens your heart, it strengthens your lung function, it strengthens your musculoskeletal system, so that even after your treatment ends, you will be able to regain your strength more readily and be able to tackle the daily activities in your life. And that's very important as it contributes to your overall quality of life, even after recovering from a cancer diagnosis. So without further ado, Dr. C and I will be showing you a video that we created, especially for all of you here, to demonstrate some of the key but simple exercises that you can do in the comforts of your own home. So Li Fang, you can start with the first exercise. Now, this first exercise is what we call the pull apart. Essentially, this exercise targets your upper back muscle as well as the muscles on the back of your shoulders. Now, how do you do that safely and effectively? Now, the main thing is to start slowly, start carefully. Now, if you feel that there is any resistance in the joint mobility, be gentle with the movement. So when you look at the slide on the left-hand side, Dr. C will be showing you the more regressed version of the exercise, whereas for me, I'll be showing you the standard version of the exercise. So as you can see here, Dr. C is not using any form of equipment at all. She's only focusing on opening up the arms so that she can feel a gentle stretch in the chest muscles while focusing on squeezing the shoulder blades gently together. Now, the effect that this exercise creates is to slowly and gradually warm up your shoulder joints so that eventually your shoulders are more mobile and you would be able to lift up the arms without feeling any discomfort. So how many times do you do this band pull apart? Now, for a start, if you are very deconditioned, you have not done any form of resistance exercise at all, we highly recommend that you start slow. Maybe you just want to do 1 or at most 2 sets of 10 to 12 reps, just to get a sense of how it is like to move your arms in space. All right, now with a simple band, you can actually feel the stretch. Now, if you don't have any band at all, you can alternatively use light weights. Now, if you don't have any light weights at all, you can even use water bottles as a form of replacement. Now, how much water you fill up in the water bottle will then change the weight of the water bottle itself. So with that kind of variable, you can easily adjust the intensity of the exercise. So as I am explaining this movement, you can even experiment it on your own right now without using any form of equipment at all. All right. So once you're done with the band pull apart, right, you're going to move on to the next exercise, which is called the band press. Now, essentially, the band press targets at your chest muscles. Now, when you have gone through a breast surgery, definitely there's going to be some form of a scar tissue formation, which will then restrict the movement in your shoulder joint, and the tightness would tend to occur very frequently in the chest and the upper back region. Now, what this exercise does that is very particularly useful is that it helps to activate the underlying chest muscles below the breast tissue. So when you wrap the band around your upper back and then you push up the band gently, what you should be feeling is a gentle tension in both sides of the chest wall. Now, Again, Dr. C on the left-hand side, she is demonstrating the more regressed version of the exercise. Now, just merely by extending the elbows back, all right, thinking of squeezing your shoulder blades together gently, you should also be able to feel a gentle stretch in your chest wall. And from there, think of pushing your arms together in a inverted V manner so that you can feel that both sides of the chest wall are being squeezed towards the central location in front of you. Now, this movement itself should be adequate for you to feel some tension in your chest wall. Now, if you want to progress the intensity of the exercise, you can feel free to use light weights as what you have done in the previous exercise using the light dumbbells or the water bottles, or if you're feeling adventurous, you can definitely use the band. Now, just a pointer here, the band itself is a fantastic tool to use in your home exercises, but bear in mind that the thicker the band is going to make the exercise more challenging. The thinner the band, the easier it is for you to be able to carry out the exercise. So as you can see here, the basic principle of this exercise itself is to pull back your elbows, squeeze your shoulder blades together before you push out your arms in an extended manner. So again, you can slowly work out 1 to 2 sets of 10 to 12 reps each, just to have a sense of the movement. Now, the main thing throughout this exercise program is to take it slowly. If you're not able to feel any muscle activation at all, the most crucial thing is at least minimally feel that stretch in the chest wall so that you are able to slowly release and degrade the scar tissue in the affected area. All right, Lifan, we can move on to the next exercise. All right, now the third exercise is what we call the chair bend row. Essentially, this is a pulling exercise that targets the upper back muscle. So as you can see on the left-hand side, Dr. C is demonstrating the more simpler version of the row. So she's bending over and she's pulling her elbows to the back, squeezing the shoulder blades together at the same time. Now, with every squeeze, intentionally feel the upper back muscle contracting at the top of the movement. Now, for me, I am performing the standard version using the resistance band. So that means that the exercise is a little bit more challenging because now there is an added resistance. Now, in this second video here, Dr. C is using light weights. Again, you can repeat the use of the light weights in the previous 2 exercises, or if you're using water bottles, that can work very well as well. Now for me, I am actually now doing the exercise over 1 foot instead of both feet in the previous video. Now what this does is that it increases the range of movement because I'm making the band a lot more lax. When the band is a lot more lax, that means that the intensity of the exercise is a lot easier on your back muscles. Now again, the key thing is comfort. If you feel any resistance in the shoulder joint, you feel any pain or any discomfort, take it very slowly. So you can start off with 1 set, 2 sets of 10 to 12 reps and eventually work it up to 3 sets of 12. Now, why 10 to 12 reps? Again, you just want to have a feel of moving your joints, moving your limbs in that range of movement to get familiar with it so that eventually you're able to build up your confidence in doing these exercises. Now, as we move on from the third exercise and the fourth exercise, we are targeting specifically the upper arm muscles. So the overhead tricep extension targets the upper arm muscles, the back of your arms. So as you can see here, Dr. C is using the light weights on the left-hand side, and for myself, I'm using the resistance band. Just to reiterate, the resistance band tends to be more challenging because the tension tends to be fixed. Whereas for the dumbbells itself, you can adjust, especially if you're using the water bottles. Now, the main thing about this exercise is that you want to maintain a nice neutral spine with your core muscles slightly engaged. Now, on the video, you can see that in certain at certain times, Dr. C is exaggerating the movement of her upper body, which is not encouraged, because then you might end up in straining your lower back muscles. So if you find that you are feeling a lot of unnecessary strain in the lower back, back off the exercise, reduce the weight of the exercise, or focus on doing the exercise one arm at a time, so that you can get to experience using the muscles in the correct manner. All right. So once you're done training 2 to 3 sets of 10 to 12 reps of that movement, you can then move on to the next exercise, which is the bicep curl. So the bicep curl is really straightforward. You're using light weights to curl up the dumbbells or the water bottle. Now, in this case, you can do it either standing up or sitting down. The main thing is being intentional in bringing up the weights so that you feel that good squeeze of the muscles at the top. So again, Dr. C is demonstrating a poor example where you are swaying to and fro. That is definitely a no-no, because you are risking low back injury by performing such exaggerated movements. So if you are experiencing lower back discomfort, we advocate that you do it seated down, so that you are more comfortable, and then by doing so, you're able to focus on the movement quality better. All right. So again, do it very slowly, progress very slowly. Perhaps if you are you're feeling very weak, start off with 1 and then 2 sets of 10 to 12 reps. And when you're feeling more confident, build it up to 3 sets of 10 to 12 reps. All right. Now, the last exercise of the day, we're going to move on to the dead bar. Now, the reason why we are including a core exercise called the dead bar is because most cancer patients, after going through the cancer treatment process, they tend to go through very extreme deconditioning in their muscular strength. Now, what this translates into is that because of that weakening in the muscles, the core is not able to support the body weight as well as it used to before the treatment. So what it leads to is that there is a higher tendency of you feeling low back strain, low back discomfort, especially after prolonged sitting or standing or holding heavy items. Now, in this case here, by performing a core exercise regularly in your daily life, you'll find that the symptoms of weak core strength disappearing, because now you're engaging your pelvic girdle, your abdominal deep muscles better, so that it will support your daily movements better overall. Now, how are you going to perform this exercise correctly? Essentially is to lie flat on the floor with a mat supporting you. Now, in this first version that I'm doing right now, this is the most basic version. So with your lower back fully glued to the floor with no space between the spine and the floor, you're going to lift up 1 foot at a time with your knees bent. So you should be able to feel a gentle contraction in your abdominal wall, one side at a time, whenever you lift up each leg. Now, when you lift up your arms above your shoulders, essentially you are engaging your abdominal muscles better. Now, what I'm doing now is a slightly more advanced version where I'm alternating the leaning backward of my arms and the straightening of my leg at the same time. So, for example, if I'm straightening my right arm, I'm straightening my left leg. So what this does, it will activate the core muscle even more intensely on the contralateral side. So when you do this, all right, you should not be at any point in time feeling too much unnecessary strain in the low back. If you do, back off, go to a more regressed version of the exercise, like what you're seeing now here, so that you can really focus on the contraction of your abdominal muscles instead of the muscles in your lower back. So how many reps can you do in this exercise? Again, think of 1 to 2 sets, 10 to 12 reps each on each side of the abdominal wall. You do not want to overextend yourself, particularly when you are now recovering from your cancer treatment or you have not exercised for a very long time. Now, again, safety is always key whenever you're doing exercise while recovering from a major illness like cancer. Take it very slowly, build up your confidence so that you are able to perform the exercise effectively. So now, once you have gone through the entire circuit of 6 exercises, you can feel free to take a breath, a few breaths, take a break, drink some water, and when you feel recovered enough, you can resume a second and then eventually a third round of the same circuit. Now, how many times can you do these exercises per week? Now, for a start, if you're doing it on a lower volume, meaning to say that perhaps you're doing only 1 to 2 sets for each session, maybe you may want to do 2 to 3 times a week, minimally in alternate days, with 1 day of rest in between. Now, it should not be particularly strenuous. It should act more like a supplementary exercise to supplement your cardiovascular exercise so that overall you are training your body to be stronger in terms of its aerobic function as well as the musculoskeletal function. All right, so Li Fang, yeah, so now without further ado, all right, now that you have a basic idea of how to do these exercises, I invite all of you to do these exercises together. All right, you can grab hold of a chair. A dining chair will work very well in this context. All right, and then, all right, once you have gotten a chair, all right, we're going to start doing these exercises together live. Okay. All right, so before we begin, we're going to do warm-up exercise here. All right, so Dr. C on the left side, she's squeezing her shoulder blades together. All right, and for me, I am just doing a simple pull apart without using any equipment at all. So the key focus here is squeezing your shoulder blades together gently so that you feel a light activation of the muscles between your shoulder blades. All right, if you feel any stiffness on any side, especially on the left, the affected side, it's okay. Respect the boundaries of your body. Take it gently. Now we are going to do that 10 reps. All right, so be intentional. Focus on the quality of the muscular contraction. So the main thing that you want to take note of is to keep your shoulders down and back. All right. So now what we are doing, we are engaging the mobility of your shoulder girdle. Now in this case, Dr. C is doing a movement, something like that replicates running. So she's warming up her upper body as well as the core by standing up and doing the alternate arm swing. For me, I'm doing arm circles while seated down, and that's fine. The main thing is that you want to warm up the shoulder joints. All right, so once you are done warming up, we will then proceed to the first exercise. All right, so the first exercise is called the band pull apart. So with your small weights or resistance band, or if you want to do it body weight, that's fine. All right, we're going to do 10 to 12 reps, focusing on squeezing the shoulder blades gently together and feeling the stretch, chest muscles. Right, main thing, keep your shoulders down and back, don't shrug it up, because once you shrug it up, you're going to use the wrong muscles. So this video here shows us using light dumbbells, alright, but the principles of the movement is the same. we are done with 10 to 12 reps of the band pull apart. If you are resting now, do take a rest until you take a rest. If not, we will then move on to the next exercise. We're going to do the band press. So for Dr. C, for those of you doing body weight, alright, squeeze the shoulder blades together as you bring your elbows back, and then think of pushing the entire arms forward. So you should think of squeezing the two nipples together when you are pressing your arms forward, so that you feel a gentle squeeze of your chest wall on both sides. Now if you are using a band, right, it's definitely going to be more straightforward because the band is giving you a kinesthetic feedback here. So the band is wrapped around the middle back, and then holding on the ends of the resistance band, you're going to push your arms forward. Now in this video, you're going to see how we're going to do it from the side here. Now potentially you might feel some slight core activation in your abdominal area. That's perfectly normal because this is meant to be very much a full upper body exercise. So in this video here, Dr. C is using light weights. Light weights work perfectly well as well. You might feel some strain in the upper arms. Again, like I say, always take it slowly. You don't have to rush your progress. The main thing is to feel the activation of your muscles in the right places. In this exercise, the key target areas are your chest wall, the upper back muscles, as well as your abdominal wall muscles. Now, in this video here, if you are feeling particularly tight or stiff on one side, you can do the exercise one side at a time. So Dr. C is doing in a single arm band press, a dumbbell press in this video here. So when you are focusing on doing the exercise one side at a time, it allows you to perform the exercise without the distraction of having to coordinate your movement patterns during this exercise. So again, 10 to 12 reps, take it slow at your own pace. Now in this third exercise here, we are going to do the row. The target muscles here in this exercise is your upper back muscles, particularly those that are near your armpits. Now if you have a band, you can follow my example, wrapping the band around both feet and then pulling the band towards your back, your legs slightly extended. Now if you don't have any equipment at all, you can follow Dr. C, but now Dr. C is doing a full example now to show you a negative example. The main thing is to keep your chest proud, spine neutral, and when you bring your elbows back, you should still continue to focus on squeezing together gently so that you can get contract the upper back muscles, which tend to be weakened very easily during periods of deconditioning. Now, of course, secondarily, when you exercise your upper back muscles, it will also contribute to improving your overall posture. Now, again, if you find that you have one side that tends to be stiffer or less mobile than the other side, you can follow Dr. C's example here. She's doing the exercise one side at a time. Now, you can easily replicate that either using a body weight version or using a light weight like what Dr. C is doing now. The main thing, pull the legs together and feel the squeeze in the back muscle. Now in this fourth exercise here is really straightforward. We are working on the back of your upper arms, which we call triceps. If you have light weights or resistance band, you can follow our example here. The main thing is that keep the spine neutral so that you're not placing excessive strain on your lower back. If you feel really tired, you can perform the exercise with the light weights while seated down so that you really can focus on doing the exercise correctly. slowly or at your own pace. You don't have to follow the speed of our exercise. And if you find that your muscles fatigue earlier than 10 to 12 reps, it's perfectly fine as well. You can always slowly increase the number of repetitions the next time you repeat the exercise. Now again, if you find that any one side tends to be stiffer or less mobile or more challenging to perform the exercise at any one time, feel free to regress it and do it one side at a time so that you can really focus on performing the exercise with good quality reps. Now for the fifth exercise here, we are doing the bicep curl. So you can do it with definitely with light weights or water bottles. If you have a resistance band that works perfectly fine as well. For the ease of demonstration, we are using light weights here. So the main muscles that you're feeling is your biceps. Here, Dr. C is performing a core example. So try to maintain a straight neutral spine. Avoid excessive movement. If you find that you are straining too much, sit on your dining chair and focus on repeating the movements with good quality reps. So if you find that you are not able to perform the exercise to the full required number of reps, 10 to 12 reps, feel free to take a break in between or reduce the weight of your equipment so that you can perform the exercise with ease, right? Because at the end of the day, we are talking about activating the correct muscle, progressing at your pace so that you do not compromise your own safety. Once you're done with 10 to 12 reps, feel free to take a break, right? Drink some water. Then we will prepare to move on to the last exercise of the circuit, which is called the bed bar. For the last exercise, going to find a comfortable place, right? Lie flat on the floor. Spine straight, no spacing between the spine and the floor, right? You can, with the legs bent, you can perform the basic version, which is knees bent, and one leg at a time, lift up your leg. So if this version is too challenging for you, feel free to rest your palms on the floor so that you can really focus on contracting your abdominal wall muscles. Now, right now in this video, I'm performing the more advanced version, right? So alternate arm and leg, you're going to extend, leans back. Now, each time you extend the alternate limbs backwards, you should feel an intense contraction in the abdominal wall. And that's the intended effect of this exercise. Now, at any one point in time, if you feel there's excessive strain in your lower back, rest the exercise back to the bent knee version, or just focus on holding the position until you're not able to do so without feeling the low back. So once you're done with 10 to 12 reps each side, that would amount to 20 to 24 reps in total. You can then stop, take a break, drink some water, take a breather, because we're going to go through another round of the same circuit. So essentially, what you need to remember is that upper body exercises for post-breast surgery patients do not need to be complicated. The main thing is about strengthening the muscles, maintaining the muscle mass, and maintaining the basic level of muscular strength so that you have the confidence to perform the daily activities of living during or even after your cancer treatment. Because the most important factor that determines your quality your ability to do things, which is then directly correlated to how strong your muscles are in terms of performing these movements. So on a side note, while this presentation today is very much focused on resistance exercise, I can't stress enough that it is also very important for you to engage in some form of aerobic exercise. What is aerobic exercise? Aerobic exercise refers to your cardiovascular exercise, or what we call cardio for short. So this type of exercises target at strengthening your cardiorespiratory function, which is your heart and lungs function. Now, aim to engage in some form of cardiovascular exercise for at least 100 to 150 minutes per week. It could mean 20 minutes of brisk walking around your estate. Now, be conscientious in doing aerobic exercise, because when you supplement these upper body exercises with your aerobic exercise, it will definitely facilitate in your recovery and, more importantly, help you to restore some level of muscular endurance strength. So once you're done with this full circuit, feel free to perform another round of the same exercises.